Welcome everyone, and thank you for joining me on my stress series. Today the topic is, did anxiety and panic attacks exist during the ancient times? And I want some interaction actually, and so my question is, do you think, and it's just a simple yes or no, if you can just punch that in, do you think anxiety or stress or panic attacks, did those exist in ancient times there? And so today, just give me a yes or no, and that'd be super helpful there. So today we're going to unpack three things. I'm going to answer that question. Number two, I'm going to be talking about what's the difference between an anxiety attack as well as a panic attack. Okay, we're going to differentiate that. And I'm going to share with you some of what we do here at Brio and some other ideas to help you if you are going through some anxiety right now. Okay, so that's what we're going to do. So while I'm kind of, it's still introing everything, just give me a yes or no what you think if you think anxiety attacks are common back then. So let me introduce myself. So my name is Dr. Jeffrey Lee, and if you're joining us for the first time, welcome. And I'm doing this series on stress because just recently, or especially the past few months, a lot of my patients, a lot of friends and families are just under a lot of stress, and a lot of them don't even realize how much stress they're under. So that's one of the reasons why I wanted to launch into this stress series. Now a little bit more about myself. So I am I'm a health nerd, and I'm not afraid to say that. Now I love studying all the kind of cutting edge new neuroscience, so a lot of the new science. But I also love studying a lot of the ancient practices. I love studying the wisdom of Chinese medicine, Ayurvedic medicine. And my role with all my patients is I'm trying to actually combine the best out of both worlds and personalize it for each of my patients there. So that, I think, makes me a little bit different, a little bit more unique compared to other people. Yesterday, I went for a walk with my family after dinner, and I bumped into a good friend I hadn't seen in actually many, many months. And we started chatting, and he's a bit younger, really healthy individual. But I was really surprised to find out that he told me that he actually recently had to check himself into the hospital. And I was really surprised. Now, this guy is really, really busy, young family, and his work is very stressful, and sometimes he has to pull in 90 hours a week there. So it's a pretty intense, and I think it's kind of finally catching up to him, and he started experiencing a lot of physical symptoms that after a meeting at work, he told me, he just told his boss, I just don't feel well, I'm going to head to the hospital. And so they checked him all out, and fortunately he was okay, but they diagnosed it as sort of an anxiety attack there. So that is, these are the type of stories that I'm hearing more often than not. So I think that's why this stress series, I think, comes at a really good time there. And I also just wanted to remind all of you, I'm getting a lot of responses and questions about my stress quiz. So again, the URL is howstressedareYou.com. And I'm really excited about this, and I'll share a little bit more later, but I invite all of you, just please share that link. It's a free quiz, and of course it's not like a diagnosis of anything, but I created this Brio health or stress pyramid, and I just want to bring kind of awareness to people, and are you in chronic stress? Are you in burnout, or are you balanced, or are you thriving? I think that's actually very important for you to know where you're at, and then so with that awareness, you can take some actionable steps there. So please check out that quiz there. Okay, so let's dive into it. So did anxiety and panic attacks exist during ancient times, or are they a product of our stressed out, modern day lifestyle or culture? So my first thought was, well, back then, I'm wondering if life was just so much simpler back then. People, were probably a little bit more in touch with nature. They're not as bombarded with a lot of, our current day stresses, like our news feeds or, social media, cyberbullying, like all of that. So that was my initial thought. And then I thought a little bit further. Well, back in the ancient times, I wonder if food was as readily or as easily available, or if there was a lot more threats around there, maybe threat from a predator or threat from, war or battles there. So, perhaps that was more, on top of their mind then. And yeah, so after thinking through that, oh, and the other thing I was thinking about is just people in different social economic classes. Maybe they're under a lot more hard labor back then. So I was curious. So as I was preparing for this talk today, I started diving back into some of my school notes there. And I was reminded that actually there's a lot of discussion in a lot of the ancient texts about stress, about anxiety, about panic attacks. And I'm going to unpack that right now. So there's a few of these disorders that when I was a student, you would hear about this, and not having treated like thousands of patients now, but back then I was like, why would that doesn't make sense there. So the first disorder we're going to talk about that's well documented in these ancient Chinese texts. The first one is called restless zong disorder. Restless zong disorder. Zong simply means organ systems. So there's restless or this uneasiness in the organ systems. And for some of you who are watching this, if you remember back to my other series, the Wisdom of Chinese Medicine, where I talked about brain power, I remember how I talked about that in the Chinese medicine diagnosis, there's actually no brain as an organ. Like a lot of the stresses and the emotions, whether it's anger, frustration, fear, they're not all central in a brain. There isn't. It's actually all distributed among the different zong organ systems there. So check out that, and this maybe will make a little bit more sense. But so the restless zong order is described as this. It's an emotional disorder resulting from long-term overthinking and over-worrying. So it's an emotional disorder resulting from long-term thinking and over-worrying. And it injures the spleen, the heart, the liver meridian systems there. And it also says that there's an unpredictable or an inappropriate emotional response. So that could be like fits of anger, frustration, sadness. It also talks about maybe digestive issues. Oh, and also it talks about sleep disturbances. Now, those symptoms are actually quite familiar, right? A lot of my patients are coming in with some of those symptoms there. So doesn't that sound like modern day stress for a lot of you, whether it's like sleep disorders, digestive issues, emotional imbalance? So this, again, was very well documented, called restless zong disorders there. And this goes back thousands of years. Now, the second one that has a very interesting name, this next one is called plum pit qi. So plum as in the fruit, pit as in the seed, and then qi means energy. So what is plum pit qi? So plum pit qi is the sensation of blockage or a constriction in the throat area. Now it's not like phlegm or it's not like physical swelling, because I've had a lot of my patients come in with this sensation of just, after many months of stress and they're dealing with anxiety, they start getting this kind of obstruction here. And they've seen their EENT specialist and they send a scope down and there's no inflammation, there's no swelling, there's no obstruction. It's this sensation that there's a blockage there. And plum pit qi is a result from long-term emotional disturbance with a qi stagnation. And that sounds very much like an anxiety disorder, right? Or having too much anxiety. And that's exactly what my patients are telling me. So can any of you relate out there? I don't know if any of you have experienced that, but early on in my practice, I was very surprised when patients were starting to tell me that, hey, I'm experiencing this kind of obstruction. I can eat just fine, but it's just this tension that I'm getting right here. So this is very interesting. So Chinese medicine has this concept of something called a qi stagnation. So energy blockage or energy stagnation. That stress can lead to sort of this more physical manifestation, called stagnation or plum pit qi. So there you go. So there's restless zone disorder, there's plum pit chi, and this third one I want to explain to you is called, again, a very, very funny name. It's called running piglet syndrome. And essentially, running piglet syndrome is that sensation where you're having, like, you know, hundreds of you know, steps, like, just trampling on top of your chest there. So you get this kind of like overwhelming sensation of you know, fear and discomfort there. So running piglet disorder or syndrome is documented thousands of years ago, and it's called a stagnation in the liver meridian system, or the liver condition, where that chi or that energy rises upwards, and it causes like heart issues such as chest pain or palpitations, and anxiety and fear and dizziness. So all those words were used, documented in these ancient texts. And again, that is so similar to what we call a panic attack in our Western society. So stress, anxiety, panic attacks are definitely part of, you know, a lot of the ancient texts there. And because they're written in so much detail, Chinese medicine actually has some amazing natural solutions to treat these conditions. So we'll unpack that in a moment. Now, my point number 2 is I want to differentiate between what an anxiety attack is and what a panic attack is. And because often those terms are used quite interchangeably, but they are different. Now, if any of you have questions along the way, feel free to keep asking them. Now, let's define what a panic attack is. A panic attack comes on suddenly, and it usually involves intense fear. Okay? So it comes on suddenly and usually involves intense fear. And it's usually like the fear of dying or the fear of losing control. And another description of a panic attack is there's a sensation or a feeling that they're just disconnected from their body. Okay, so that's a classic definition of a panic attack. And this is, you can find this in the DSM-5. The DSM is the Diagnostic Statistical Manual of Mental Disorders. And so panic attacks are described in there. And the physical symptoms, so very much like what I was saying about the running piglet syndrome, the physical symptoms are shortness of breath, a racing heartbeat, nausea, dizziness. So those are well documented in the DSM-5 there. So panic attacks also have an unexpected origin or an expected origin. So the unexpected one is a lot of people have panic attacks without any, we're not sure what the cause is. So it's a mystery for a lot of people, where all of a sudden they just get this sensation of fear and their heart starts pounding. And there's also the expected, where some people have phobias. If you can imagine, if you're scared of snakes or scared of heights and you're exposed to that, you know, you can get into sort of a panic attack. Is that clear there? Again, please ask if you need to clarify anything there. Now, let's contrast that to an anxiety attack, because an anxiety attack is actually not as clearly recognized or defined in the DSM-5. And the reason is because people's anxiety attacks vary. Like they're very different. You know, some people might have a lot of worry, or they might have this distress, or, you know, they'll have fear or this sense of overwhelm. And there are overlaps between a panic attack and anxiety, but an anxiety attack can be, you know, mild, it can be moderate, or it can be severe. And I think the key thing to understand with anxiety is an anticipation. So it's an anticipation of a stressful situation, a stressful event, a stressful experience. So the anxiety is that anticipation where it hasn't happened yet, but you're worrying about it, you're ruminating, there's that fear that this is something that's going to happen, something negative is going to happen. So again, like I said, there's many similarities between panic attacks and anxiety attacks, but the key thing to differentiate this is anxiety usually builds up gradually, versus a panic attack is sort of a sudden onset, and it's very abrupt there. During a panic attack, what's happening is your fight or flight response. I talked a lot about the fight or flight, that autonomic nervous system. It's kicked into high gear. So that adrenaline rush, it's really affecting you physically. So the physical symptoms are very intense, usually very disruptive. So like I said, some of my patients who've had panic attacks, it just feels like their chest is just rapidly beating, or they just feel this huge unease in this chest region there. And I also said earlier, anxiety can be mild, moderate, or severe, but often you can still function with even an anxiety attack there, or having anxiety. Some people can still go through their day, but in the back of their mind, they're still kind of processing or ruminating or dealing with just it's a lot of in their thoughts there. Okay, so that's point number 2. Let me go into point number 3 here. And so point number 3 is what can be done to treat anxiety or treat panic attacks there. Now, the first thing I do need to say is it's very, very important if you are feeling that you're having like this overwhelming anxiety, or you are feeling that you're experiencing these panic attacks, it's super important to make sure you work with a professional. And I really encourage you not to diagnose yourself. I know there's a lot that you can read online, but it's really important that you have a professional assess you. And it's because it's in my opinion, it's very important to not just look at the symptoms, but you really need to be able to communicate to a professional sort of the entire story, the entire picture. Because just looking at the symptoms sometimes only gives us, as a professional, half of the story, or half of the picture. I do like to hear the entire story. I like to hear the background, what brought it on, what's going on, just really understand all of that to see where you're at. And speaking of a professional, it's very important that you find one that you trust, that it's a trusted professional that can sort of journey along with you. Because it's not, anxiety, panic attacks, or intense stress. It doesn't work by, here's a pill or here's some medication and go off and deal with it on your own. A lot of the success cases that I've had success treating, we've really built a good team around these people, and they've got good support with their psychologist, their medical doctor, myself, friends and family. So it's a real, it's very important. I really wanted you to get some proper diagnosis, and as well as get a good support team around you. And just to give you sort of an idea of a customized approach, things that we've done in our practice is, or I might have referred patients out to do some cognitive behavioral therapy. I've also worked with my patients to improve brain chemistry. And I've shared with a lot of you that I'm fascinated with the brain, and I think nowadays we are so deficient in a lot of very important nutrients to build up brain cells. So nutrition is very important. A customized detox approach is very important. Another thing that I do is I like to regulate the nervous system. I've been studying with just a group of amazing practitioners, and we're learning how to better assess and measure where our nervous system is. Why are we dysregulated, right? There's no diagnosed illness. You can't see this imbalance, on an MRI or an X-ray, but you just know that you're not feeling well. So having some diagnostic tools to help you measure that, I think, is very, very important. Okay, so that's my first point. Make sure you seek a professional if these are quite serious, these symptoms. Number 2, I really want to highlight that naturopathic medicine, Chinese medicine, or the alternative approach, it is very proactive and preventative. And I just really want to drive that message home, because a lot of you who are watching, you might not be having any anxiety or panic attacks right now, but you're under a lot of stress. So it's very important that you acknowledge that and you do whatever you can to be proactive and be preventative. So, and that's one of the reasons why I created that stress quiz there. And because I want to make it in a very casual, fun way where you can answer a few questions and sort of see where you're at. Some feedback that I've received from some of my patients is, wow, I didn't realize that I'm in burnout right now. It just gave me a different perspective. I thought I was handling everything really well, and that just invited some good conversations. Why are you in burnout right now? Or I've had some patients where, I'm a little bit surprised. I'm a little bit in chronic stress. I thought that I'd be a little bit worse off. So this actually sparked some really good conversations there. So please take that stress quiz if you haven't, and actually what you're going to get, I'm not going to spoil the surprise for all of you, but we put a lot of effort into this, our team, to give you some actionable steps there. So for those who are having a little bit of stress there, take the quiz. You're going to get a PDF, and it's going to give you some actionable steps. And I've also put all of our sources on that. So you're going to have all the sources where I got some of my research and information from, so you can dig a little bit deeper there. So that's a gift to you there. Now, what else do I do in my practice? So I've talked to you about like a neurological assessment. To me, that's very, very important. I do a lot of acupuncture in my practice. And for those who are not familiar with acupuncture, it is such a wonderful ancient practice that really grounds the body. It really balances, I said, remember the Zongfu, the restless Zongfu syndrome? It balances the liver meridian, the heart meridian, the spleen meridian. It grounds the body. It calms the nervous system. It switches your body and brain to go in that go sympathetic nervous system, to switch it off so you move more into that parasympathetic nervous system, that rest and that digest. So in one acupuncture treatment, I can often see that stress completely transform with my patients there. So I'm a big believer in acupuncture and how effective it is. Now, some other things that we do at our clinic is we look into some herbal medicine. And I told you earlier how in Chinese medicine, in the ancient texts, there's a lot of information on which herbs are appropriate for which conditions. So I might assess my patients. You might be stressed out, but you're more on the wired side. Or you might be stressed out and you're completely exhausted and tired. Or you're stressed out and you're a person that worries all the time. Those are all very different conditions in Chinese medicine. And how I approach it, again, I customize it for each individual as I approach it very differently. So that's how we approach it with herbs, for example. And then in my practice, I also do a lot of talk therapy. And I think it's very important to create that safe environment and just to become like a sounding board for my patients and just help them process certain things. And I really enjoy doing that. So I hope that gives you sort of an idea of how we approach it at Brio, or how I do it in my own personal practice. So again, just to summarize and wrap things up, so stress, anxiety, and panic attacks are well documented in the Chinese literature that goes back thousands of years, and they do have a lot of very great natural solutions there. We differentiated between anxiety attack and panic attacks there, where the panic attack is that kind of sudden, abrupt onset and usually involves a lot of fear. And third point, I also just shared with you, different strategies. Sometimes you do need a professional, or you can start working with a acupuncturist or a naturopath that will help you be more proactive and preventable. So thank you for joining me, and I'm just going to make myself available just for a little bit longer if you have any specific questions. This is, again, an important topic for me. I do treat this a lot in my practice, and there are no silly questions, so if there's any questions right now that you want to ask, please do so. And we can always continue that conversation. I love that you guys are all so interactive and giving me these ideas on what to speak on. And again, keep those coming. I am, again, really excited about my stress quiz, so share that with your friends there. And my course on just overall health is putting the finishing touches on that, and I'm going to be launching a webinar to introduce that sometime next week, so stay tuned for that as well. Thank you very much. Have a wonderful day.